Welcome to Disease SNS. In this video, we will be talking about 10 most common sexually transmitted diseases. If you are new to this channel, please hit the subscribe button and turn on your notification for more videos about diseases. Sexually transmitted infections or diseases are infection transmitted through sexual contact, caused by bacteria, viruses or parasites. They are mostly transmitted through an unprotected vaginal, anal or oral sex with an infected partner. Some of this infection cannot be treated or cured, while others can be completely treated and cured. The first most common and highly contagious sexually transmitted infection is the human papilloma virus infection. This infection is caused by a certain types of the human papilloma virus, and it is spread through an unprotected vaginal, anal or oral sex with an infected partner. It can also be spread through close skin-to-skin touching during sexual intercourse. Ejaculation or penetration must not occur before the virus can be transmitted. There are over 100 varieties of the human papilloma virus, more than 40 of which are passed through sexual contact, and can affect the genital, mouth or throat. Some cases of the human papilloma virus may not cause any health problems, or cause any noticeable symptoms, but some types of the virus can lead to the development of genital warts and cancers of the cervix, anus and throat. There is no cure for the virus itself. It usually goes away on its own within 2 years, but in some cases, it might remain in the body and develop some health problems like genital warts and cancer. That is why a routine screening for the virus is important for identifying, monitoring, and treating these health problems that may arise as a result of the infection. The second most common sexually transmitted infection is chlamydia. This infection is caused by the bacteria Chlamydia trachomatis. It is also spread through an unprotected sexual intercourse with an infected partner, and ejaculation must not occur before the infection can be transmitted. Pregnant women can also transmit the infection to their babies, especially during delivery. This infection is most common among younger women, but it can also affect men. It can affect several organs in the body including the penis, vagina, cervix, urethra, rectum, anus, eye and throat. When a person acquires the infection, it may cause an abnormal discharge of a yellowish substance from the penis or vagina, painful and burning sensation when urinating, painful sexual intercourse, itching around the vagina in women, and around the opening of the penis in men, and lower abdominal pains. Chlamydia can be treated and cured completely with antibiotics such as doxycycline and azithromycin. If it is left untreated for a long time, it can lead to pelvic inflammatory disease and infertility in women. The third most common sexually transmitted infection is gonorrhea. Gonorrhea is caused by a bacteria called Neisseria gonorrhoeae. It usually affects the mucous membrane of the reproductive tract, including the cervix, uterus, urethra, and the fallopian tubes in women, and the epididymis and urethra in men. It can also infect the mucous membrane of the mouth, throat, eyes, and rectum. Ejaculation must not occur also before the infection can be transmitted. It is also spread through an unprotected vaginal, anal or oral sex with an infected partner. It can also be transmitted from an infected mother to child during pregnancy, delivery and nursing. Gonorrhea is characterized by a painful or burning sensation when urinating, an abnormal penial and vaginal discharge in men and women, inflammation of the testicles in men, and lower abdominal pain in women. It can be treated and cured with antibiotic ceftriaxone. When left untreated, it can also cause infertility. The fourth most common sexually transmitted infection is herpes. Herpes is a highly contagious viral infection, caused by the herpes simplex virus. The virus is classified into two: herpes simplex virus 1 and herpes simplex virus 2. Herpes simplex virus 1 usually causes sores or blisters around the lips or inside the mouth, which are often called fever blisters or cold sores, while herpes simplex virus 2 causes sores in or around the genitals. Herpes simplex is highly contagious that it can easily be spread when a person comes in direct contact with an infected person's mucous membranes, saliva, or the oozing fluid from a sore. The infection cannot be cured. Once acquired, it remains in the body and continues to display some certain signs and symptoms from time to time. Number 5 of the most common sexually transmitted diseases is syphilis. Syphilis is a bacterial infection. It is caused by the bacteria Trichomoniasis palladium. It is spread through direct contact with a syphilis sore in an infected person's body, during vaginal, anal or oral sex, and through cuts on the skin or mucous membrane. It can also be transmitted from an infected mother to a child during pregnancy. Syphilis usually develops in 4 stages. The early stage or primary syphilis usually develops between 10 to 90 days after exposure. It is characterized by the development of small smooth and painless sores around the genitals, anus, rectum, or mouth. These sores usually go away within 3 to 6 weeks, whether treatment is given or not. The secondary stage syphilis begins 6 weeks to 6 months after exposure. It is characterized by the appearance of rough red or reddish-brown rashes on the palms of the hands, and on the bottom of the feet. The third or latent stage syphilis is a period when there are no visible signs or symptoms of syphilis. At this stage, syphilis is present in the body, however a person might not know, and it usually takes so many years before progressing to the next stage. The fourth stage or tertiary stage syphilis is usually rare, and it develops as a result of untreated syphilis infection. It can appear 10 to 30 years after exposure, and can be deadly. Syphilis can be treated and cured at an early stage with penicillin antibiotic. The 6th most common sexually transmitted infection is hepatitis B. Hepatitis B is a serious liver disease. It involves the inflammation of the liver, caused by the hepatitis B virus. The virus is acquired from contact with infected bodily fluids like blood, semen, vagina, open sores, and saliva. This contact could happen during an unprotected sexual intercourse, through shared needles or syringes, shared toothbrush, razors, or nail clippers. It can also be transmitted from an infected mother to child during pregnancy and delivery. There is no cure for hepatitis B, however, it can be prevented with a safe and effective vaccine, which is usually given at birth. Hepatitis B is characterized by the yellowing of the eyes, nausea, abdominal pain, fatigue, and dark urine. The 7th most common sexually transmitted disease on the list is trichomoniasis. Trichomoniasis is commonly called trich. It is caused by a parasite and spread during sexual intercourse in semen and vaginal fluids. The name comes from the parasite Trichomonas vaginalis, and it mostly affects the genitals. However, it can also affect the anus, mouth and hands. This infection is most common among Black women, and people assigned females at birth. However, men and people assigned male at birth can also be affected. The symptoms of trichomoniasis include a thin or foamy white, yellow, or greenish genital discharge that has a bad odor, pains or discomfort during intercourse and when urinating, and soreness or redness around the opening of the vagina. Up to 70% of people never have these symptoms. However, they can transmit this infection to other people. When symptoms occur, they usually appear within 5 to 28 days after exposure. Trichomoniasis can be treated and cured with antibiotics such as metronidazole and tinidazole. When left untreated, trich can last for months or even years, and can increase the risk of developing HIV. The number 8 of the most common sexually transmitted infections is mycoplasma genitalium infection. This infection is caused by the bacteria Mycoplasma genitalium. It is also spread through an unprotected vaginal or anal sex with an infected partner, and usually affects the cervix, urethra, or the rectum. Mycoplasma genitalium infection usually does not show any symptoms, or if they do, they are mostly similar to the symptoms of chlamydia and gonorrhea, which may include genital discharge and burning when urinating. It can also be treated with antibiotics, and when left untreated, it can lead to serious and permanent health problems in women, including infertility and pelvic inflammatory disease. Number 9 is HIV/AIDS. HIV stands for Human Immunodeficiency Virus, while AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is a chronic immune system disease, caused by the human immunodeficiency virus. HIV damages the immune system and interferes with the body's ability to fight against infection and disease. This virus can be spread through contact with infected blood, semen, or vaginal fluids, which may be through an unprotected anal or vaginal sex, shared needles or syringes, and other injection equipment. This infection is characterized by the appearance of rashes, fever and chills, swollen lymph nodes, headache, night sweat, fatigue, diarrhea, and weight loss. HIV cannot be cured. However, treatment with certain antiretroviral drugs can help an infected person live a longer and healthy life. Number 10. Pelvic inflammatory disease. Pelvic inflammatory disease is a serious infection in the uterus, fallopian tubes and ovaries, which develops when sexually transmitted bacteria such as Neisseria gonorrhoeae and Chlamydia trachomatis spread from the vagina to the reproductive organs. This usually results in pains in the lower abdomen and pelvis, unusual or heavy vaginal discharge, unusual bleeding from the vagina during or after sex and between periods. Pelvic inflammatory disease can be treated and cured by taking medications that will get rid of the infection or bacteria that cause the disease. However, this treatment cannot reverse any scarring or damage caused to the reproductive tract.